So I'll let you do your thing on anybody.
Well, welcome everyone to the Wolfpack Wellness Research web series. I am your host, Dr. Susie Goodell. As a reminder, this series is a collaboration between University Wellness Advisory Committee, the NC State Libraries, and NC State Wellness and Recreation. We aim to discuss the wellness research happening across NC State's campus. For those of you joining us live via Zoom, you can submit your questions to our speaker in the chat function. We'll have a Q&A time at the end of the show. So today's guest is Dr. Annie Hardison Moody. Dr. Hardison Moody's research, work, and teaching are at the intersections of religion and health, and she has research experience in the areas of gender and sexuality, health promotion, food and food insecurity, and gender-based violence. She is an associate professor and extension specialist in the Department of Agricultural and Human Sciences, where she directs and served as the lead author for Faithful Families, Thriving Communities, a research-tested faith-based health promotion intervention out of NC State Extension and the North Carolina Division of Public Health. So thanks for joining us today, Dr. Hardison Moody, or as I call you, Annie.
Thanks for having me.
So why don't we just get started and you tell us a little bit about who you are and your research lab?
Sure. So I would say, first of all, that I don't have kind of a traditional research lab. As an extension specialist, a lot of the work that I do is focused on working with our family and consumer science agents and extension professionals out in the field around both religion and health. So I work on a program called Faithful Families, Thriving Communities, where we're empowering faith communities to be change agents around the health issues that impact their communities. Primarily, that's been access to healthy foods, places to be active. We've done some work around, or starting to do some work around mental health. And I also love working with our agents on kind of understanding community assets and thinking about how the assets that exist in their communities can be harnessed for health and health equity. And so I think my research lab, I guess you would say, is kind of the state of North Carolina. And I have the honor of getting to work in some really incredible communities. And, you know, as Dr. Goodell or Susie said earlier, I work at those intersections of religion and public health and have for a while. So I don't have kind of a traditional like focus of my health work. I've worked in a lot of different areas, from gender-based violence, post-conflict transformation, reproductive health, and then since I've been at NC State, a lot of my work has been in the areas of food and food insecurity. But what I'm really interested in is people and how people make meaning, particularly around ideas of health and healing, and how, you know, to really sit with whether it's people or whether it's communities to understand how they prioritize health, how they think about healing, what meaning they make out of that, and then how can we partner and collaborate to build health or to create more equitable spaces. So that's a little bit about what I do.
That's great. So I know I mentioned briefly the idea of Faithful Families, Thriving Communities. Is that something you would like to share about with us?
Sure. So Faithful Families, Thriving Communities started in 2007. And at the time I was working in the Division of Public Health, doing worksite wellness programming actually. And at the time at the division, we had some really strong programming working in African-American churches, but we didn't have any programming that could be used kind of across religious communities, across denominations, across kind of race and ethnic groups, racial and ethnic groups. And so we brought together a big, diverse group of stakeholders and had a big meeting to think about what would that look like? Is there interest in developing a health promotion program? And at the time I was in the physical activity and nutrition branch. And so we were really focused on food and physical activity. And so we were able to develop this program, and we knew that to have the reach, that the partnership with Extension would be really important. And so from the beginning, it's been a partnership project, even though then I was on the public health side and now I'm on the Extension side. And the Faithful Families Thriving Communities program is developed was developed as an intervention based on the socio-ecological model. So there are discussion groups that people in religious communities can use in partnership with their extension agent or with health department staff to help them think not only about their own personal health, but also about the health of their family and then the health of their community. So they're thinking together about, what are some things that I could do to improve the foods that I'm eating and the ways that we're cooking in my family, but also how could we do that in our religious community? And how could we, think about the broader issues that shape our community, whether it's food insecurity or whether it's, people in our community don't have access to a playground. So what if we opened up our space and made our playground open to the community? And I see Kim Eshelman is on. Kim is our current project manager, and we've been, it's just been amazing to see how the program has grown over the years as we partnered with local communities in North Carolina and now across the country. It's implemented in lots of different states through Extension and through public health. And we're really growing with Kim's leadership, I would say, into more of a, we're leaning into that kind of storytelling piece that I was talking about earlier, and where the curriculum, it has some didactic moments because it's a nutrition education curriculum, but we're really moving to more of a how does who you are shape the foods that you eat and the things that you value? And then how do we kind of build on that and hear from people's stories? Because that's how I think change will happen, is if we can root it in who we are and our community, our sense of community. And so that's kind of been the latest direction of the program and what we're trying to do. And like I said, also incorporating, thinking about health in a holistic way, with also incorporating mental and emotional health. And but yeah, so it's been amazing to see the growth of Faithful Families from, we worked in 3 counties in 2007 to now, across North Carolina, and like I said, across the country.
That's wonderful. So I have a question about the implementation process. Mm-hmm. You go into a faith-based community, and whether it's Kim or someone else that's going out there and interacting with the community, how do you go from hearing stories to making change?
That's a really good question. So the first thing that I will say is Kim and I and the other state staff, whether it's our Steps to Health, our SNAP Ed program, or our FNEP staff at the state level, our role is to support the local folks who are implementing the program. So it's implemented locally through family and consumer science agents or health department staff, or in some places, across the country, it might be another SNAP Ed implementing agency. And the way that we've built the program is that we have these health educators or extension staff paired up with, and they train lay leaders from the local faith community to implement the program together, ideally co-teaching together, where the lay leaders are bringing in, we have all sorts of prompts and things in the curriculum for this, but it's every religious community makes it their own. But where the lay leaders are bringing in connections to their religious traditions and practices and beliefs, and making those connections with whatever they're talking about, whether it's, drinking more water or eating more fruits and vegetables. So making those connections. And so I think that's some of the ways that we've been able to see that with Faithful Families over the years, is through the strong kind of lay leader empowerment model of supporting the inherent, amazing leadership potential that already exists within these religious communities where our educators are working, and helping them to see, oh, there are resources, whether it's in your, physical space that you have, or in the traditions that you embody, or the practices that you do each week that relate to what we're talking about with health. I will never forget, this one was years ago. We were doing a a program, a 3-year program we had at the Islamic Association of Raleigh with the women's committee there. It was just amazing. And the lay leader talked about how the act of prayer for Muslims itself was a way of like moving the body, and how that connected with physical activity and how important it was to like move your body during the day. And so they make those connections. Like, I don't know what it's going to be for somebody. I don't know what it's going to be in that particular community, but the people from that community do. And so I think that's how we kind of have up until now gotten to that story piece of because it is really built as a very strong partnership implementation model.
Thank you. That's very helpful. So when looking at all of that, what I'm hearing is there are different outcomes depending on which community you're working with. And so that's part of the extension piece. And we know that evaluation and assessment to say, hey, this is a good program, everybody should be thinking about doing this. How do you go from the outcomes are different for everyone to evaluation to say this is effective, we should keep doing this?
Well, the way that we have done that is through a really strong partnership with FNEP, with the Expanded Food and Nutrition Education Program, and with our SNAP-Ed program at NC State, Steps to Health. So when agents or educators are implementing Faithful Families through those programs, they use our messages are the same, right? Like, we're telling the messages are the same. It's, we want people to be drinking water and eating more fruits and vegetables and being active whenever they can. And so we're able to look at an individual level, like we do a entry form and an exit form at the end of the 9-week classes. So we're able to look at behavior change, like in a very short term. Obviously, like, I would love to go back and do longitudinal work on have people been able to maintain those behavior changes longer term. So on an individual level, that's where we're getting some of that data. At a community level, we developed a tool called the Faith Community Assessment. And the Faith Community Assessment is, initially we used it in the program as kind of a pre-post because it's a tool to help the community to see what assets they have. Like, do they have kitchen space? Do they have a playground? Do they have even space where, they could convert to an exercise space, like an unused classroom, for example. So they see all of those things. And also there are questions about the kinds of policies that they have. Like, do they have a policy to serve water at all events and things like that? So we used to use that as a tool to measure change, like over the course of a year in the faith community. Did they, like, maybe their score was X at the beginning of the year, because it's a scored instrument. It's based on the CDC worksite. I forget what that tool is called. I should remember it, but there's a CDC worksite audit, basically. And we kind of looked at that. It's different, but we looked at that as a model. So we have used that in the past as an evaluation tool, but the way that we use it now, I would say in programming, is more as a planning tool for communities to begin to plan and dream and think about what they have. Our Steps to Health team, someone on our Steps to Health team helped us a few years ago to think about the tool used to have just like, do you have this, yes or no? And now it has yes, no, and no, but I'm interested in that. So we can sort of, that's a way for the agents who are working with them or the FNEP educators to connect them with an FCS agent or health department staff to say, like, look, this, community is interested in opening up their playground for shared community use. And so that's one of the pieces, but I will say measuring outcomes for systems change or community change, it's really hard, and it can be really messy, and I have no good answers. Those are some of the ways that we've been doing it, but it's really, I think it's really hard because every community is different. And I think one of the amazing things about the program, but one of the things that Kim and I feel sad about sometimes is that there are really good things happening, and sometimes we're not capturing them, or and not in the sense of like I want to hold them and keep them, but in the sense of like we're not able to tell the story of all the great things that are happening because the instruments are not as wide to help us see everything. It's just not possible.
So I know you and I both have an interest in qualitative research with the storytelling piece. What kind of, have you been able to publish qualitatively on the work that you're doing, and what kind of outcomes were you able to present, or findings were you able to present with that?
We have, over the years, we've definitely done focus groups with faithful families participants. Some of the interesting things in the early focus groups when we were developing and implementing the program in the early years that we heard from participants were about the centrality of relationships. So the participants felt very strongly that one of the reasons why they enjoy the program and why they kept it going was because of the relationships that they were able to build with the FNEP educator or the FCS agent. So it was, you know, and some of the quotes, for example, that will still stick out with me is like one of the participants said, she didn't come in expecting us to change, to adapt, to be like she wanted us to be, but she wanted to learn who we were and took the time to understand who we were as a community. So I think that first piece of like relationship and trust building that can happen over the course of work in a community is really important. One of the other interesting things that we found early on was that participants they appreciated that the focus of the program was not at all on weight or bodies or losing weight, or the word obesity is not used, like those kinds of things that we know can be stigmatizing. And so that came through like loud and clear. Participants said, I love that it was about what can I add on to my life instead of what I shouldn't be doing, and kind of making me feel bad about what I'm doing. And since then, some of the things that we've learned have been, in conversations with lay leaders and with facilitators, is that this interest in a kind of more holistic vision of health and thinking about beyond, because, initially we were really focused on physical activity and nutrition, because that's where I was sitting and where, we had, funding from the CDC and Kate B. Reynolds to implement it that way. But since then, I think that's where some of this kind of more open storytelling based program is coming from, is from listening to lay leaders and the field staff who are implementing the program, to see like, we're not always the priority for, or we, and I mean, we, like, I'm speaking we as extension, whatever our priority is not always the priority in the communities where we're working. So how can we lean into that? How can we, even if we're not doing mental health work, how can we be connectors to help them get the resources that they need or support them in the ways that they need? So I think that's some of what we've been hearing more recently is how to think more holistically. And we haven't done any qualitative research since the pandemic, but I would guess that's even more so the case since we've been dealing with COVID.
Yeah, a lot of things to think about for the future.
Mm-hmm.
Job security. So with that, I'm curious, how do you identify the groups, the faith communities that you work with? Is it just anybody who shows interest, or how does that work?
The agents and the staff, the educators and the folks on the ground are really the ones doing that. And in some cases, it's determined by, let's say if they're working through FNEP or SNAP-Ed, they're working with participants who have, fall into a lower income bracket because they're SNAP eligible, or they're, and so, but on the other hand, we really, Kim and I, in the training that we do and the programming that we provide, our hope is that the partners that we have who are doing this work in the communities are thinking about those health equity issues, and that they're working in communities where there might not be a strong connection to extension or to the health department. And how can this program, the other thing that we found is through the qualitative research, is that this program can start to be a bridge to other extension programs, to other health department programs. We have some folks in the state of Florida from the health department who are doing like the opposite. They were doing COVID vaccine work during the pandemic. And so are now Faithful Families is like the next, thing that they're doing with communities. So it's like, how can we think about the resources that people need, especially people who might not always come to a health department or come to extension or even know that we exist and are there to serve them. So we think about that with educators as they're trying to think about how they, who they work with. But, and the other way that people come to the program is like somebody might hear about it or word of mouth. Like in Edgecombe County, there's a lot of that because we had a really successful, and we've had a really successful Faithful Families program there for years, so it just kept growing and there was like word of mouth. So one church would do it and then they'd, kind of hear from other people. So it sort of varies.
So while I am getting your attendees, please start typing in questions for Annie. My one little tidbit that I have to ask is, so I've heard you say SNAP and SNAP-Ed quite a bit. You defined FNAP, but some people who are watching this live or on recording may not know what those things are. Can you give us just a little touch of what that is and why it's important?
Thank you very much for asking that. And sorry, I didn't define that one. SNAP is the Supplemental Nutrition Assistance Program, and that's for lower income people and families. It's support for food for people who are in those lower income brackets. SNAP-Ed is the kind of education and outreach arm of a part of the USDA, and it's a grant program that works to provide education for communities that fit those kind of SNAP eligibility guidelines. And so at NC State, our SNAP education program is called Steps to Health. And they're a part of NC State Extension in the same way that FNAP, which is the Expanded Food and Nutrition Education Program, is. And FNAP works primarily with families with children. So that's the difference. SNAP-Ed can also work with people who are not, who might not have children, but FNAP is really has that family focused with, which is why it's been historically such a beautiful fit with Faithful Families.
Yeah. So y'all give me some questions because I can sit here and talk to Annie all day long, but I want to make sure she's responding to your interests as well. So while we're waiting on that, what is next for y'all in terms of where you're heading with Faithful Families or other avenues that you may be exploring?
I think what's next for us is something that, as I mentioned, Kim is leading, is this kind of exploring what might it look like to have a really kind of more story-based nutrition education program. I've been really inspired by the work that Dr. Maru Gonzalez does in our department on the youth development side, with like centering her work in storytelling and with youth. And I think Kim has done a lot of work in this arena. And so I'm really, really excited about that because I think it's a way for us to move, for us to stay relevant in extension. Like extension's always, I believe extension's always relevant, but I think it's a way for us to like keep centered on people's lives and who they are and how we can connect with them and their communities. So I'd say that's a big piece of it. And then the other thing that we've been working on and thinking a lot about is mental health, and how do we integrate thinking about mental health with thinking about physical health, and how do we think more holistically about people and what they're going through and how they have, how they're able to think about health at all.
Mm-hmm. Okay, so I've got a couple of statements here. One is from Megan. She says, no question, but I just want to comment that I love that you brought up building relationships and reaching out to the communities and asking for their input and what their needs are. So thank you for that.
Thanks, Megan.
And then Jane asks, can you share how you work with educators to build their skill in working with community partners? I'm not sure young professionals have had much experience in this during their college experience.
That's a really good question, Jane, and something that we try to do in our Faithful Families trainings with agents and educators. But so much of it is things that I've honestly learned from our agent educators in the field. And a lot of it is about presence. So it's about showing up and showing people that you care and that you care about them more than just a number. Like you're not, I think sometimes researchers get a bad rap because we go in, and I say we because I have done this, you go in and you implement a program and then you leave. The reason why I love working in extension is because when I'm working with an agent, like the extension office will always be there. It's always a part of that community. And so I think it's about like helping if you want to build authentic partnerships and relationships, it's about being there. It's about showing up. It's about understanding what people's priorities are and letting go a little bit of more than a little bit maybe of that ego of like, you have to be in control or you have to be, driving this, which I will be honest to say for other researchers out there makes it really hard to get funding because funders don't want to hear that you're going to do that. They want to hear that you have concrete objectives and that this is how you're going to implement those objectives. It's very hard to get funding for like community-based research in that kind of way. So presence, care, like building those skills of compassion, which compassion is a skill, it's a practice. If you want to learn more about building compassion as a skill, a good friend of mine has an organization called The Courage of Care. And they train people in like building skills and compassion, especially people who are in kind of the quote unquote helping professions. So how do we build those muscles? And I think for, I teach in the Youth, Family, and Community Sciences program. That's one of the things that we do in our classes as well is it's not like research to me is not this kind of academic ivory tower thing where you're sitting over here. It's about being with people and how do you be with people?
Yeah, I would agree that whole idea of it. I tell my students the community is the expert, right? We're just here to learn.
Mm-hmm.
I think that coming from that framework is very helpful. So you kind of mentioned something about grant work and how it's hard to get grants because of community-based participatory research is like very unknown to some people. So maybe this pulls into it, but is there controversy in what you're doing or other schools of thought about how we should be approaching working with faithful families and communities?
It's so, yes. And I would say it's not a controversy, but it was really interesting. A few years ago, I was a part of a special issue on religion and public health for the American Journal of Public Health. And as a part of that AJPH issue, they brought the authors together for like a conference and conversation. And this was the thing that came up the most in that conversation. And we were there with representatives from Health and Human Services and the CDC, like very, very high level people, and trying to get this across that like those of us who especially work with religious communities, there are so many places of broken trust in communities. And if we really want to make impacts in communities, it takes time to build trust. It takes time to build relationships. It takes time to repair and to turn away from those practices that have harmed communities in the past, and to learn about how we've done that and to say, to change. And so I definitely think that's like, that's a very real challenge. And I was really glad to hear in that group that we're all making the same case, whether it's in the field of religion and public health, or whether it's in other fields that are doing community-based kind of participatory research. And I think there's been a lot more interest in that kind of work, which is good. But yes, I absolutely think that that's a kind of controversy, because you can look at religion and health in a very clinical way. There are measures of religiosity that people use to understand, religiosity compared to, what people's health impacts are coming out of the hospital or, with hospital readmission. And all those things are very important. But then there's a whole school of people doing this kind of like community engaged work it's harder to fund because we can't put those hard numbers on it.
For sure. Well, Annie, this has been a wonderful 30 minutes. We were talking about how quickly things go by, and I'm willing to bet that it went really fast for you too.
Yes.
I could sit and talk with you for hours, as I said, but I just wanted to thank you for speaking with us about your research and your extension program, because they go hand in hand. And I want to thank all of y'all for watching, and want to remind you that we broadcast every third Friday of the month at 2 p.m. Eastern Time. Next month's show will include an interview with Dr. Jocelyn Taliaferro from the School of Social Work. She will be talking about the Black Women's Mental Health Study. You can find more information about the Wolfpack Wellness Research web series and previous shows on our Wolfpack Wellness website. So I am your host, Dr. Susie Goodell, and until next time, be well.
Thank you.